Imagine yourself in the middle of flu season. You've contracted the flu for the second time, and you're dreading the long hours spent in the doctor's office, waiting for the 5-minute checkup just for the doctor to prescribe you yet another antibiotic. So, to avoid this, you go into the medicine cabinet and reach for the antibiotics left over from last time. While this may be more convenient for you by spending less time and avoiding a trip to the doctor's office, you are only harming yourself more. This is due to the bacteria that have become and will become resistant to the antibiotics that you are about to take. These resistant bacteria are known as superbugs. Superbugs are becoming more and more of an issue. According to the editorial board, with these superbugs, standard treatments will no longer work, infections will be harder to control, the spreading of diseases will become easier, and hospital stays will become prolonged. According to Reuters, superbugs cause 2 million infections and 23,000 deaths annually. So as you can see, this is a very serious issue that we all need to be aware of because myself, as well as all of you, can be directly harmed. I have researched numerous articles, websites, and newspapers where I have gathered an abundance of information over the subject of superbugs. So today I'm here to spread awareness to all of you so that you can take the necessary precautions to protect yourself as well as your family. To better understand the subject at hand, I will first define what antibiotic resistance is, and then I will talk about the causes and ways that you can prevent it. So first, what is antibiotic resistance? According to the Alliance of Prudent Use of Antibiotics, it occurs when an antibiotic has lost its ability to control or kill bacterial growth. So in the presence of these antibiotics, these resistant bacteria will still be able to grow and multiply. There are a couple ways that these bacteria become resistant. One is through genetic mutation, which are changes of the bacteria's genetic mutation. This can happen by some producing chemicals or enzymes that will inactivate the antibiotic. Others will eliminate the cell target that the antibiotic is trying to attack. Another way is by acquiring resistance from other bacteria. This is through conjugation, which is a simple mating process where bacteria are able to exchange genetic material. Now that we know what it is also important to know what the cause of it is. According to Sun, a major reason is due to the overuse of antibiotics. In this study, it showed that 47 million unnecessary prescriptions are given every single year. Another study by the editorial board showed that between the years of 2010 and 2011, 506 out of 1,000 prescriptions were not an appropriate use for the solution for the illness. These were mostly given for conditions that don't respond to antibiotics, such as viral infections like the flu, the cold, or a sore throat. Doctors are only prescribing these antibiotics due to the pressure from their patients. There are two critical factors that you need to consider if you are prescribed antibiotics. According to Scott, one of these factors is taking them on time. When you miss a dose, the levels of the antibiotics will be lower than the level of the concentration necessary to stop the growth of the bacteria. The second is to complete the entire dose of antibiotics. The resistant bacteria will not be wiped out until the end of the course of the antibiotics. While you may feel better in the middle, you'll likely become ill again if you do not complete the entire course, and is likely to become more severe the second time. Another factor is where you live. According to O'Connor, 3% more of people are prescribed antibiotics in the South than anywhere else. The reason for this is unknown, but the study has proven that where you live does play a factor in these resistant bacteria. So now that we know all of the causes that make antibiotics resistant, how can we prevent it? There are several things that we can do. For one, the CDC suggests washing your hands. We can avoid getting ill, and we can prevent the spreading of other bacteria to other people. Another is to stay up to date with vaccinations. It is always to prevent than to treat it. Another suggestion from the Mayo Clinic News Network is for physicians to change their prescribing habits and patients to lower their expectations. This one will be very crucial due to the major cause of antibiotic resistance being that the overuse of antibiotics. Now, let's summarize what we have discussed. Superbugs, which are antibiotic-resistant bacteria, are becoming more and more of an issue. This occurs when an antibiotic has lost its ability to control or kill the bacteria. There are many reasons, however, the overuse is the main concern. With the seriousness of this issue, it is important to practice good personal hygiene, keep up to date with your vaccinations, and to not abuse the antibiotics that you are prescribed. For now, the only thing that we can do is create awareness and protect ourselves from this from occurring. We will soon determine the fate of our future with these superbugs. Only time will tell.